Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. Want to welcome Dr. Christopher Reilly. He is a respected fellow of the American College of Surgeons, a qualified and experienced surgeon. Dr. Reilly started a private practice in West Houston area in 1997. He's highly experienced in laparoscopic procedures. Dr. Reilly specializes in bariatric surgery, having advanced skills in gastric bypass and gastric sleeve procedures. And then is an expert in the use of the lap band and the Obrera intragastric balloon. Today, though, we are going to talk about another specialty that he has, and that is gastric reflux. Welcome, Dr. Reilly. We're glad to have you today.
I'm glad to be here.
People always talk about gastric reflux or heartburn. What is gastric reflux anyway?
Gastric reflux is when gastric acid passes up into your esophagus, which is basically your swallowing tube. And it's very commonly referred to as indigestion, Gerd. It's extremely common. About 20% of the population have. Now, what we worry about in Gerd, when we talk about medical or surgical for managing Gerd, it's not just your occasional heartburn, which again, reflux, heartburn, and Gerd are essentially the same for most people. That's how they understand it. If you go out and eat something very spicy and you have some indigestion or again, reflux, and you take some over-the-counter medication and you're fine, then you don't need to do anything about it. Just, watch what you eat. And that's not really something that you would see a physician about. We would want to see a physician about reflux is when you're having problems more than 2 to 3 times a week where you're having to take medication. If you're having problems sleeping at night because you're refluxing, some individuals will have such bad indigestion. Again, reflux indigestion, we really are talking about the same thing in lay terms, where they can't even sleep at night because the fluid is coming back to the back of their throat and they're having to sleep on pillows. In those situations, it would be a good idea to see a physician and pursue the next steps in evaluating how bad your reflux is.
So, Dr. Reilly, you hear some people saying, oh my God, it's terrible, like you were talking. If it goes untreated, can it create serious problems or other health problems?
Well, it can. So untreated moderate to severe reflux can cause respiratory issues. So if you imagine, if you're refluxing acid up into your esophagus, that can also back up into your lungs, particularly when you're sleeping at night. A lot of patients will complain of chronic cough, alteration of their voice. Sometimes they'll get even pneumonia and chronic bronchitis. And so there are reasons why people, if they have these symptoms, should go see a physician. Now, it's really untreated for a long period of time, then you can get damage to the lower end of the esophagus. We call that esophagitis. When you get esophagitis, if it gets severe enough, it can cause scarring and stricturing. Stricturing means narrowing of your swallowing tube, so you may have difficulty swallowing your food. Rare cases, it can actually proceed on to something called Barrett's esophagus, which is a precancerous condition. And so you can imagine if you're having severe untreated reflux, it can lead to a whole complex of difficulties medically. There's another condition where we have what we call a giant hiatal hernia, or where people have a large disruption of the diaphragm where the stomach slides into the chest, and they'll have symptoms of chest pain when they eat, and not even reflux, but they'll have chest pain and they'll feel like they're having a heart attack. Those definitely need to be evaluated. At any point where you're having chest pain, you should see a physician.
Okay. So, and I also know sometimes you go to the doctor and I'm going to give you Protonix, Nexium. There's several drugs out there. And it kind of fixes it, but it doesn't. Would the surgery be for those people too?
Well, first of all, we have to think about how bad your reflux is and how to proceed with your individual symptoms. That's why it's a good idea to talk to your physician about what your options are. First of all, you should try and modify your diet. A lot of times, just diet and weight loss, we know that losing weight significantly decreases your incidences of having reflux. So modifying your diet, and in particular, things like alcohol, tobacco, things that are very caffeinated like coffee, chocolate, greasy foods, and weight loss. So doing those types of things, if your symptoms resolve, you don't really need to do any kind of medication. That ultimately would be the best option. But if you are having frequent symptoms, then you would want to start first with your over-the-counter medication, something like Tums or Rolaids. And if you take Rolaids once a week and you're fine again, you wouldn't really need to do anything else. The more powerful medications, like you mentioned, the omeprazoles and the Nexiums and things like that, that were all pretty common over the counter now, they almost completely shut down all the acid production in your stomach. And if you only have to take that once a month, then you're fine. Again, that may be a very good option for you. But there are some individuals where they take those medications and they're having what we call non-acid reflux. So if you can imagine, if the medication suppresses the acid in your stomach, but it doesn't stop the backwash of fluid to the back of your throat and into your lungs, you can still get a chronic cough and voice changes and things associated with that. And in those situations, when you're on medications and you're still having symptoms, that would be the time to, first of all, consider surgery. Another reason to see a surgeon would be if you simply don't want to take medications. These medications have side effects. They don't work for everybody equally. Some people don't tolerate them very well. And we know that long-term daily use of these really strong acid-suppressing medications can have some long-term consequences. And some patients may not want to deal with those consequences and would like to opt for surgery.
So would this surgery then fix GERD permanently?
So the most commonly done surgery for reflux is a procedure called a laparoscopic Nissen fundoplication. But before you'd actually get to surgery, you'd want to be evaluated to see if that is something that would help you. And individuals that have that and have reflux often have what's called a hiatal hernia. A hiatal hernia is where the stomach slides a little bit up into the chest and allows that acid to wash up into your esophagus. And the surgical treatment for the reflux would be to repair that defect where the stomach is sliding up into your chest. And then the Nissen fundoplication is where you wrap the stomach around the top of itself to create a small little knuckle like a new valve. And this is a very good surgery. It is done only after you've failed these other treatments that we've talked about. It's a very, very good surgery. It's been around a very long time. It's done laparoscopically. A laparoscope is a small little TV camera. I usually make 5 small incisions in the abdomen to do the procedure, and the procedure takes anywhere from 30 to 45 minutes, and most people go home the next day. Most people are back to work within about 7 to 10 days. No heavy lifting for a good 6 weeks afterwards. But no operation has no risks. Some people do get reflux again. We do know that if you look very, very closely with x-rays and CAT scans, that a moderately high rate of seeing the hernia come back. But when we survey patients as far as their symptoms, there are very few people that actually have symptoms of reflux coming back, even if x-rays show the hiatal hernia may have come back to a certain degree. In the other case that I mentioned, in individuals that have very large hiatal hernias where the stomach sometimes can have the entire stomach up in the chest, those individuals absolutely need surgery, whether they're refluxing or not. And a lot of those patients don't reflux, they just have pain and have trouble swallowing. Those patients should be directly referred to a surgeon rather than trying weight loss and diet and pills. And in that case, the surgery is almost the same. Again, it's a laparoscopic repair. So the stomach is pulled out of the chest. The diaphragm is repaired, usually with stitches. And oftentimes we will do a stomach wrap with that. And again, that is something to prevent them from actually getting the severe complication of the stomach getting in the chest and twisting and having problems with the stomach either getting obstructed or becoming gangrenous from a poor blood supply. So as you can imagine, there are degrees of hiatal hernias and degrees of risk with the surgery. But most patients tolerate the procedure very, very well. Back to work within about a week or so or less. And most patients are very happy with the fact that they don't have to take medications anymore. They're not sleeping on pillows anymore. The hoarse voice goes away. The chronic cough often goes away. And for most people, this is a long-term benefit, and they usually don't end up taking medications again.
So, Dr. Reilly, this brings up a question for me. You talk about hiatal hernias. Usually you'll hear if it's not bothering you, or I can position it back in place, it's no big deal. It sounds like it is a big deal, and the sooner you take care of it, the better it is.
I think a lot of people are very confused about the term hiatal hernia because we hear hernia so much. Hernia is a general term, roughly meaning, something's passing through something else. And so we often hear about it. We call it sports hernias, incisional hernias, groin hernias, where you have a bulge that kind of sticks out and you can push that back in. That's what most people think about when they think about a hernia. What we're talking about with esophageal hiatal hernias, this is something that you actually can't feel or push back in. It's deep inside your body where the esophagus comes through your diaphragm muscle and meets your stomach. And so from that perspective, yes, the term is hernia, but it's not something that you would think about. You had a groin hernia fixed as a child, a little bit different. And
Okay.
and the incidental finding of a hiatal hernia. So for instance, if someone just did an x-ray and said, oh, by the way, you've got a hiatal hernia and you have no reflux, you have no trouble swallowing, you have none of the pain or discomfort that we talked about in your chest, then nothing needs to be done. There are lots of people walking around. Actually, the majority of people have hiatal hernias, probably don't have severe reflux that need surgery, don't have reflux bad enough to need the stronger medications. And with a little diet and weight loss and diet modification, their symptoms are completely controlled and are perfectly fine. And they shouldn't come see a surgeon. They definitely don't need surgery. What we're talking about is someone that is, despite all these other measures, they're still refluxing 2 to 3 times a week. They're still having to take precautions like sleeping on pillows. The medications that they're taking either aren't working well enough, they're having problems with the medications, or they don't like the long-term potential side effects of medications and don't want to take medications. Those are the individuals that should be considered for surgery.
Okay. So for our listeners, they can kind of go to their doctor, discuss the problems they're having, and then see if it's an alternative for surgery, if they have to have an authorization. If not, I'm sure they want to come straight to a surgeon and their insurance allows it. They can come straight to you and you can do the exam.
Well, absolutely. And we would do the full workup where we check to see if they have a hernia, to see if they have inflammation of the esophagus, to make sure that, we're not dealing with something else. If they have, a stomach ulcer that they thought was reflux, but they're just having stomach pain from a stomach ulcer, you want to treat that obviously first. And then, the last option really would be surgery once you've tried everything else.
And I imagine this is covered by insurance.
Yes, this is not something that usually you have a problem with insurance. If you have reflux and you have, you're having inflammation of your esophagus, or you're having, symptoms as we described earlier, most insurance carriers would approve surgical repair for a hiatal hernia.
And just for our audience's information, Dr. Reilly has an excellent staff that's always looking to help the patient in any way they can. They're very attuned to the insurance coverages and everything like that. So they're in good hands in your office.
Absolutely.
Is there anything else you want us to know about this surgery, or anything that we're missing? Because this is interesting. I didn't even realize there was a surgery to fix this.
Yeah, unfortunately, a lot of individuals aren't really aware that there is a treatment for their bad reflux. They take the medications, they suffer with reflux, even though they're told that the medications will take care of everything. And in some cases, the medications don't take care of it. Like I mentioned earlier, you can suppress the acid, and so you're not getting the acid reflux, but you can have non-acid reflux where you're still getting fluid coming to the back of your throat, still the chronic cough and choking sensation, sleeping on pillows and those types of things. And if you're sleeping in a chair every night because you have to sleep upright, then, why suffer? There's a relatively safe 30 to 45 minute operation that in most cases takes care of that. And many of my patients are very happy just to be able to lie flat at night in their bed, which they hadn't slept in a long time, without that fluid rushing to the back of their throat or waking them up in the middle of the night with the feeling that they're drowning because fluid's coming to the back of their throat. Those individuals definitely should be evaluated to see if they would be a candidate for the laparoscopic hiatal hernia repair with Nissen fundoplication.
I would suggest that anybody having this problem, come see Dr. Reilly and see if he can do something for you. Life is short, so it sounds like we need to take care of ourselves and do what we can that's available for us. Dr. Reilly, I want to thank you for joining us today, and a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.